prevention is of the utmost importance in all healthcare settings, but it holds a particular significance when it comes to home care. By placing a strong emphasis on infection prevention measures within the home, professional caregivers can effectively reduce the risk of hospitalizations, emergency room visits, and other healthcare interventions. Hello, this is Tiffany Robinson, training specialist for ComForCare Franchise Systems, and welcome to the Comfort Connections podcast. In this episode, best practice considerations for infection prevention in the home setting. I am joined by Sue LaGrange, a board-certified infection preventionist and chief nursing officer at Pathway Health, an industry leader in the senior services space. Let's listen in as we dive into the education, training, and robust protocols that home caregivers need in order to create a safe environment. Get ready to fully understand the importance of building healthier communities and preventing infections in the home setting.
Okay, well, hello, and welcome to this presentation, Best Practice Considerations for Infection Prevention in the Home Setting. Infection prevention and control, as you know, has been an extremely hot topic for the past 4 years, right? And we've learned quite a bit about even the basics of infection prevention and control and how they're instrumental when it comes to quality. And in a home care setting, good infection control best practice approaches can be especially important, right, for safeguarding the health and well-being of vulnerable individuals that are living, especially those with compromised immune systems, or if they have chronic illnesses or other healthcare conditions that make them more susceptible to infections. So preventing infections at home helps minimize the need for hospitalizations, for emergency room visits, and other healthcare interventions. And so we're going to talk about some practical strategies that will help maintain independence and the overall well-being and quality of life for clients and patients. So we have 3 objectives that we will be covering today. We're going to discuss the importance of infection prevention throughout the care continuum, and then we will be addressing strategies to reduce the spread of infections, and we will discuss best practices that can assist staff in implementation of infection prevention strategies. My name is Sue LaGrange, and I've over 30 years of long-term care leadership experience. And in my past over 20 years with Pathway Health, I have helped in quality improvements in a multitude of organizations. I am a national trainer in infection control, clinical management, restorative nursing, and I am a certified Interact Champion Master Trainer. And I am honored today to be joined by Tiffany Robinson, who works for ComForCare for over 18 years, and she has a BA in social work from Oakland University in Rochester Hills, Michigan, and a certificate in instructional design from the University of Maryland. ComForCare as training specialist specifically with onboarding new offices, and she helps facilitate their training programs. So today we are very happy to be here to talk to you about infection prevention and control. So infection prevention and control is actually one of my favorite topics. And today we're going to start by discussing the importance of infection prevention throughout the care continuum. So I want to start out really indicating that we all know infection prevention is not a new concept. In fact, infection prevention and control has been around in healthcare forever. So for the nurses in here, many of you will remember how Florence Nightingale believed that fresh air and pure water and cleanliness and sanitation are so helpful for health. Also efficient drainage and light or direct sunlight, all to prevent or control infections. So it's been around for a long time. Guidance, best practice approach has changed and has been updated many times. In fact, it's been updated many times in the last 4 years. So we're going to start out with an overview of infection prevention and control. So the basics of the spread of infection is so important that we take the time to educate our employees, residents, their significant others, or family members, because education is an important aspect for the prevention of the spread of infection. Even just a few minutes of the basics can be really important. So if we take a look at the basics, such as the source, we need a susceptible person, and then we can talk about transmission. And of course, we know that the source would be our patients, employees, visitors, people living in the home. But source also includes surfaces and medical devices. And so it's important that we talk with our patients about infection control. Also, the susceptible person. We work with many vulnerable adults, elderly, or people whose immune system is weakened, or people who have devices, even if they're younger, people who have either lived in or visited any medical health care facility, they can be susceptible to the spread of infection. And of course, transmission, if we look at the Centers for Disease Control and Prevention, they specifically say germs don't move themselves. They are transmitted either by person to person contact, the environment, or many times medical equipment. So if we look at hands, the spread of infection on the hands of healthcare workers is one of the number one reasons why people that are in healthcare develop infections. And droplets from coughing or sneezing, and then think about sharp items such as needles or sharp instruments. So when we think about the importance of infection prevention and control through the care continuum, I want you to think about opportunities for that spread of infection when patients or clients navigate through the various settings, such as hospitals, clinics, nursing facilities, dialysis centers. So it's important that we really take a good look at the importance of the basics of infection prevention and control. So, what can we do to be good infection preventionist stewards, right, in our own setting? Well, I like to look at three important buckets that we will be covering today. And the first bucket looks at updated best practice systems, right? The second bucket looks at employee education and competence. And then the third bucket looks at ongoing surveillance and action. So let's break down and talk about each of these buckets individually. With updated best practices, as we talk about where to access best practices or regulatory resources, I want you to think about areas such as standard and transmission based precautions, taking a look at what PPE, personal protective equipment, we need to consider, infection control concerns with following proper technique with procedures, such as device management or wound dressings, for example, even areas such as cough etiquette and respiratory hygiene or cleaning and disinfection. And there's so many more. So, where do we access these resources? Well, state requirements. Many times the State Department of Health have really good, I would say many states have really good web links that will cover guidance and requirements, and also resources to help organizations with infection prevention and control. More so today than ever. There's also federal CMS requirements. The CDC, or the Centers for Disease Control and Prevention, which is an area that provides so many resources, and they're free of charge and they're really good. I mean, these resources are evidence-based, these resources are easy to read. They include not just guidance or recommendations, but there's education and there's PowerPoints and there's posters, and they're for caregivers and they're for even patients and the general population. They have it for schools, they have it for healthcare, they have it for dental office. I mean, when you look at it for all different industries, and they really do have some exceptional resources that are available for all of you to access free. There's also evidence-based review articles and periodicals. There's current industry manuals and textbooks. And when you look at that, there are many that are kept up to date and they're evidence-based, and you can utilize them for procedures and policies to be able to give you step-by-step best practice approach. Then there are industry standards that your professional organizations or industry trade groups can provide for you. There's clinical practice guidelines, and there's accreditation bodies that will also provide information for you. And all of these, and there's many more, this is just these are just some examples, but they all lead to a good system that you can develop your policies, your procedures, and your protocols for your caregivers to be able to utilize and to teach and work with your clients that are updated, realistic, and then communicate to all that are involved in the process. So updated best practices is one of the areas that your organization will want to have good systems in place. So the next area we're going to look at, the second bucket, is going to be employee education and competency. So once we have our policies and procedures and our protocols that we have put together based on best practice approach and any regulatory guidance, then we need to consider how we're going to deliver education with a system to verify competency, because our caregivers will need to be competent. So some of the areas that we can look at is infection prevention and control 101, and even talking about transmission and hand hygiene. Hand hygiene, again, is the single most important preventative measure in the spread of infections. So it's important that we not only have employee education and verification of competency in hand hygiene with soap and water and also alcohol-based hand sanitizer, but also education on how to teach clients and patients and families and significant others on the importance of good hand hygiene. Also, when necessary, PPE, personal protective equipment, which would be our gloves, our gowns, our face masks, or if we need, our N95 respirators and eye protection. And then standard and transmission-based precautions. And so it's important that we go through and teach the staff and educate them on exactly what they need to do with different types of pathogens, or for all residents, right? Because standard precautions would be implemented in all residents, regardless of their status. So, and then bloodborne pathogens consistent with the OSHA's requirements, and then cleaning and disinfection. And we're going to talk a little bit about that today too, because that's an area that's so important. Vaccinations is a great preventative measure. So educating the employees, as well as how the employees can educate their patients and their clients on the importance of such a really important preventative approach in accordance with the ACIP recommendations through CDC. And then respiratory hygiene and cough etiquette, something that has been around even before the pandemic with COVID-19, but it has been even more important with COVID-19. And we're still in the acute respiratory season, where we're looking at influenza, we're looking at RSV, we're looking at COVID. So it's important that, and not only that, but there's also the common cold, right? But it's important that not only our caregivers, but also they can teach families and patients and other significant others on the importance of respiratory hygiene and cough etiquette. And then, of course, antibiotic stewardship, because when we're providing care, it's important that all of our caregivers have a good understanding of exactly what antibiotic stewardship is, so that we can keep everyone safe. And then infections and communicable diseases, including reporting, guidance on state and federal. We want to also provide education on employee health. And then I had mentioned reporting. There are, every state has their own reporting guidance. So, and there's also federal reporting guidance, but it's important that the leaders of the organization then have documented and keep many states have a poster, some don't, some just have a list, but that you have that available so that you know which communicable diseases and infections are reportable. And then, of course, education on policies and procedures when employees are first hired, during orientation, and then on a regular basis, or if they are updated or changed based on a change in guidance or a change in best practice approach, or if we identify opportunities for improvement. And then the third bucket is ongoing surveillance and action. And this really is important because this is how we as an organization really take a good look at what's happening as a whole in our organization, looking at infections, looking at employee infections, looking at our data. It needs to be ongoing, systematic, based on national standards. And we really should be collecting and analyzing and interpreting our data to be used for quality improvement. So if we have either employees or if we have a patient or client that has a new infection in the home, we want to take a look at that and see if there was any way that that could have been prevented. We can use that information for quality improvement. So we take all these buckets and just throw them together. And that's how we actually take a look at putting together a system for infection prevention and control in order for the program to be effective. So now we're going to talk a little bit about the impact across the continuum of care because that is so important. So let's start with preparation and planning for new patients or clients that are on our caseload. And if there is a condition change that necessitates that we need to transfer to acute care, so essentially anyone in our care that will go out for additional care, we really do need to be prepared to be able to care for them. And also, if they come to us, then we need planning, right? For do they have infections currently? Are there any potential infections? And all of these will start with the communication process because communication is going to be so essential. We need to identify any diagnoses or infections or communicable disease for planning. That is going to be so important. So let's look back. Do we have access to their vaccination history, the TB screening? Do they have symptoms of infection? Do they have a fever? Do they have any drainage? Do they have devices or wounds that are draining? What about diagnostics? Are there any recent lab results or pending labs that we really need to be concerned about? Have they been on an antibiotic and now they have diarrhea? Do they possibly have C. diff, for example? Do they have any skin rashes? Because we need to ask questions. In order for us to prepare, we need to have a good communication system that goes both ways for the patient and the caregivers for everybody's safety. And this way we can plan for any supplies or resources that we need to care for the individual in the home. And if they're going out, it will also give the hospital information on what they can prepare if someone is coming in to their organization from the home. And then guidance. We also need to follow the most current guidance. So right now, for example, in the news, there are rumors that the CDC plans to change isolation guidelines, but we haven't seen it in print yet. But we as healthcare providers will need to review carefully if and when guidance is published, because there are many times when the general population guidance and guidance for healthcare personnel have differing guidance. So we want to be really careful when we review what comes out. And then lastly, resources. Good communication, and I mentioned this above, is really going to be essential because in order for us in the home, when we go in, to be able to properly care for patients across the continuum, we really do need that communication and planning because we need those resources available to our caregivers to be able to take care of that individual and to protect everyone and provide safe care. So now we are going to talk about strategies to reduce the spread of infections. And we will actually be talking about more than two strategies today, but with the objectives, they say that you should be able to identify at least two of the strategies when the program is completed. So there are many care practices that are important for the spread of infection, as many of you know, but today we're going to discuss 6 key areas that are important to prevent the spread of infection. I had mentioned earlier hand hygiene for both caregivers, right, and patients, and even for the people in the home. There are many resources available, and the Centers for Disease Control and Prevention have on their website for hand hygiene have some really good, easy to understand education, posters, and resources for both employees and for So for, your patients or clients and their family for education, and that includes soap and water and alcohol-based hand sanitizer use. Just want to mention too that the Association for Professionals in Infection Control and Epidemiology, or APIC, have published a great resource, and it's the APIC Toolkit for Patient Hand Hygiene. And you can find the web link in your handout that was in your email. So again, it's nice to have resources. The next is appropriate personal protective equipment, or PPE. So when indicated or anticipated for standard precaution, proper selection and then proper donning, doffing, and sequencing of PPE is going to be essential. So when we're planning for a new client, the communication will be really important for us to be sure that we have adequate supplies, including PPE, when caring for that patient. And again, that includes your gloves, your gowns, your face masks or respirators, and then eye protection. And then we do need to make sure that caregivers are trained and competent on how to don and doff, including sequencing, and how to properly dispose of that PPE. Next is that respiratory hygiene and cough etiquette for everyone. So it's going to be important that everyone, whether it's patients, their families, the caregivers, that they all understand that and receive education on covering both the mouth and nose when they're coughing or sneezing, or using facial tissues and then promptly disposing of them, and then conducting hand hygiene or hand sanitizer whenever they touch their face or their nose or mouth. So it's important that that education is provided for prevention. Also, cleaning and disinfection. This area is really important. And so it is going to be important to clean a surface first to remove organic matter and then disinfect in order for that disinfectant to work. And so, depending on the situation, the caregiver should use an EPA registered disinfectant safely in accordance with the product information and instructions. And then, of course, make sure that if necessary, those chemicals are secured for safety. And then also there's safe injection practices, and that really is consistent with standard precautions. And that includes using aseptic technique with preparation and administration of single dose use for only one patient or client, and then disposing of syringes and needles in the sharps container that is puncture resistant. And so the caregiver will want to have that close to the area where they're providing those procedures, and they need to be educated on not to overfill, and then how to dispose in accordance with the state and local regulated medical waste guidance. And then there's also vaccinations. And it is recommended, of course, that caregivers and patients are up to date with all vaccinations that are recommended by the ACIP or the Advisory Committee on Immunization Practices. And since we are currently still in that acute respiratory virus season, it's important that we do recommend influenza, COVID-19, and RSV, that they're up to date with those vaccines for the patients that we care for, and also for employees. And these are just 6, but of course there are many more, but we're covering 6 care practices that can help today. So then, care transitions. The lack of good communication between settings can lead to the risk of negative outcomes. So, for quality planning for care, it will be important that we once again address diagnosis, history of infections, current infections, antibiotic use, if they have any multi-drug resistant organisms or communicable diseases or infections, or current or pending lab testing, what is their vaccination status and symptoms? Because I always recommend that whenever there is a care transition, either into your services or discharge to another healthcare entity, not only should we rely on written or electronically transmitted information, we should always have that phone call to be sure that the information is adequately communicated, because this accountability needs to be shared between both entities. And information can occur on multiple levels, right? Sometimes it is a case manager or a staff nurse or another manager. Whatever process that is used, the need for adequate and comprehensive information is essential because otherwise we have risks of infections, medication errors. There could be complications in care, even clinical outcomes, quality, and much more. So it is important that we really take a good look at those care transitions. So we briefly addressed cleaning and disinfection earlier, but let's discuss this just a bit more. And I want you to think about how you prepare for a dressing change or medical device management or procedure, and how we need to clean and disinfect both before and after the procedure. So we really do need to answer these questions. Who? Well, the caregiver. What? The surfaces to prepare the procedure, right? Where is it located in the home and how? Surfaces must be cleaned prior to disinfection, as I mentioned earlier, because the disinfectant will not work if there's inorganic matter on the surface. So we need to clean it first. And we need to be sure that we are using the right disinfectant for the right surface. So look at the product that you are using to be sure that it is safe and effective for the surface. Also, you will need to check the product instructions. Does it need to be diluted? Does it have a contact time? Do you need to have adequate ventilation? Do you need to wear PPE when you're using it? Are staff aware of the dangers of mixing disinfectants? What training have they had? Why do they need to clean and disinfect? All those things are so important. So we need to make sure that our caregivers are trained on a good cleaning and disinfection process, as well as the product management. So now that we've talked about various strategies to prevent infections, we've provided you with a handout with resources, and these here are a few, but there are more in your handouts. So now that we've addressed strategies, Tiffany has some excellent key points when it comes to training caregivers. So, Tiffany.
Wonderful. Let's spend a few moments talking about training for professional caregivers. Our number one goal when it comes to training is enhancing caregiver skills while improving the quality of care for clients. We want to promote caregiver and client safety, and we want to comply with regulations. And in turn, we want to attract and retain quality caregivers. Why does having a comprehensive training plan matter for professional caregivers? Training provides employees with the skills they need to provide quality professional care. Caregivers who receive regular training are more likely to feel supported and engaged in their roles. They are also more likely to be more satisfied and comfortable with their position. Training plays a vital role in the home care industry. It makes sure that caregivers are well equipped to provide top quality care. It helps caregivers feel supported and engaged in their roles. This can actually help reduce caregiver burnout and turnover. Training can encourage career development and advancement opportunities for caregivers. Added training and education can encourage a higher interest in learning, and interest in learning that can lead to career advancement. For example, caregivers then pursuing a higher level nursing job. Training can aid in stress relief and management. Caregivers who feel well prepared and supported in their roles can have lower levels of stress. Training can lead to improved satisfaction of clients as they're receiving consistent quality of care across the line. The more knowledge, skills, and experience your caregivers have, the higher likelihood for their productivity and effectiveness in the care that they provide. The first part of thinking about a training program and a training plan is to think not only about providing initial training to new hires, but also to provide ongoing training on at least an annual basis. It is always important to touch back on important topics to provide re-education as needed. As you create your training plan, make sure that you have clear goals. The first one of those is to make sure we include all compliance requirements. Of course, looking on state and federal level, as well as CDC guidelines, especially when we're referring to infection control. You want to communicate your training plan to your team and your staff, and make sure that you encourage communication and questions to be brought to whoever your training lead is. Regularly look at your training plan and adjust, add, remove items as needed to ensure you are constantly hitting the goal on the training you are looking to provide. Do not be afraid to ask for employee feedback, as this is how you can adjust and readjust your training curriculum to fully meet the needs of your staff. Ask them what items are missing, what topics do we spend too much time upon? Is the information presented in a digestible format? Feedback is the key to building a program that is meaningful and successful. Also, a training plan does not need to be difficult. Keep with the basics, they work. Good hand hygiene, cleaning and disinfecting measures, cough etiquette, using PPE correctly. All of these topics can and do reduce risks of infections. So do not feel like you need to recreate the wheel here in creating an infection control program. Let's talk a little bit about ongoing surveillance. Many of us are already in the homes doing reassessments or periodic supervisory visits. Make sure that you are taking advantage of seeing your caregivers in action. Are they following protocols? If not, use this as a teachable moment. Provide on-the-spot training. Coach your caregivers by example. Show them proper hand washing. Utilize these times in the home as well for resupplying your caregivers with the tools that they need to be successful. Do they have the appropriate PPE in the home, and do they have a spare supply? Do they have hand sanitizer and soap, etc.? These are the tools that they need to be successful. Also, make sure caregivers know how to request additional supplies as needed. Keeping the lines of communication open and encouraging them to reach out with concerns, be available, and respond promptly to caregivers' training questions and concerns. Now let's move into best practices.
Thank you very much, Tiffany. I really appreciate that. So Tiffany will be addressing best practices in action as well.
All right, best practices in action. Always keep your compliance requirements at the top of mind. Reassess your training plan and programs continually to make sure that you are covering all pertinent policies and topics. Now, how can you be successful? In-person training can be great, but consider leaning into technology and virtual ways to provide training. If you're not ready for a fully virtual training or not able to provide a fully virtual training, consider a blended learning model. Hold some parts or topics in person while holding other components in a virtual element. Utilizing technology can save your company time and money. Utilizing technology can also help organizations keep up to date with compliance regulations with training. It also will allow learners to work on their own timetable and convenience. Of course, we're still staying within due dates for training to be completed, but they no longer have to schedule coming into the office to complete a training, and you no longer have to present multiple sessions on the same topics or printing out a mass quantity of handouts to all of your staff members. This can be very helpful and desirable for both learners, which are our caregivers, as well as our training professionals, which many times is our nurses. Virtual training can be readily available for your caregivers 24 hours a day, meaning it's convenient. To get started on virtual training, consider looking into learning management systems to meet this need. You can purchase curriculums, or you can create something that's homegrown to meet your needs, of course, depending upon your training needs as well as your budget that you have. Now, what I'd like to do now is share an example with you of an experience that I've had with one of our locations in creating a training plan and how we were successful. We had an office who had an opportunity to provide staffing in a residential community. This community had 90% of their occupancy that we would be working with listed as bedbound. The building also had a number of policies related to infection control that they strictly wanted followed due to the clients being bedbound. They wanted us to ensure that we would be sending in staff that were fully ready to work with clients in this condition. What we decided to do here is to create an entirely separate training plan for the caregivers that would work in this particular building. We, of course, included all of our basic needs that any new hire would require. But in addition to that, we added courses and modules that would touch on the clients and the care that they would need for being bedbound. We also created a very simple course on the infection control policies and measures that needed to be complied with in this building. After creating this plan, we presented it to the building, and they were very, very happy with this. They were especially happy that we created a special course that was touching on the specific measures that they wanted followed in their building. Our caregivers need to know what's required of them, what we want them to do. So, of course, we need to be able to find a way to get this information in their hands quickly and efficiently. We have now provided that training to anyone that works in that building. We've maintained this relationship now for about 3 years. Now, even with this training plan, remember, we need to stop and take a look at this training plan periodically. For myself, at least every 6 months, I want to make sure that we are covering all important topics and adding in anything that should be included in the future. Remember, policies change, requirements change. We constantly need to keep a pulse on if the training is meeting our needs. And a best practice that I always like to mention to help you maintain caregiver success with infection control is supplying them with any tools that they need. What I mean by that is supplies, PPE, hand sanitizer, and so forth. Your team cannot be successful without the tools that they need. All right, I'll pass it back over to you, Sue.
Thank you very much for that excellent information, Tiffany. So now let's talk about how we can use some best practice approaches across that care continuum. And we talked several times earlier on the importance of preparation in order to be sure that we have supplies, that we have resources, as well as it's important that we have the knowledge and competency. And that's why Tiffany's information was so excellent to prepare our staff to be able to take care of new individuals in our care, right? And so, do you have a pre-admission assessment tool or a tool that asks the right questions? Do you have the ability to talk, as we had mentioned earlier, to the clinical staff that are directly caring for that individual in order to receive the information, all of that pertinent information that we need to be prepared? And so sometimes when we read a history and physical, or if we go through orders, sometimes we don't have all of the information, right? When we want to be able to trigger ourselves to dig a little deeper and ask a few more questions so that verbal discussion is going to be so important along with the documentation that is sent to you. We also need to then watch for symptoms, right? Because if there is an indication based on that communication that there is a potential infection or communicable disease, or if they have symptoms such as a fever, cough, drainage, then it will lead us then to really watch to make sure that we can prepare ourselves if in the event that person actually does have an infection or a communicable disease. So I want to talk a little bit about some takeaways, tips, resources today. It is important that we really do access updated relevant information to really put our systems into place so that we're able to educate our caregivers, that we're able to have evidence-based updated processes such as policies, procedures, and protocols. So in order to do that, we're going to need to look at resources. And so we want to review any association newsletters because they also provide us with some really good information as well as educational opportunities because they will give you updates on infection prevention and control. Many times they'll even give you a heads up on what is new or what is coming around the bend, what they're expecting to be seen. So that's one of the areas that you want to keep a good eye on. Also, the Centers for Disease Control and Prevention, because they have updates. And as we mentioned earlier, when it comes to infection prevention and control, the website is really just such a wealth of information, guidance, educational resources, and not only for healthcare professionals, but there's information for your patients and families that you can print off and utilize. And it's really, they do it in a easy to understand format. So there's so many resources on the CDC website. I really highly recommend that. If you haven't had an opportunity to really dig in there, that's a really great place. And then also state departments of health for infection control on their web links. I mentioned that earlier. Once again, I've noticed that state health departments have been really fabulous at publishing their guidance, their resources, as well as some really good, valuable information. They even have web links. Some of them will go to CDC or other, key stakeholders that will help you with your education. And it really does help your caregivers in relation to infection control from whether it's a communicable disease or whether it's antibiotic stewardship. It could be COVID-19 updates and guidance. Also, information on the other acute respiratory infections, influenza and RSV, as well as required reporting of infections and so much more. So the State Department of Health really has been in many states, in most states has been providing some really good resources on their web links. And then next is local public health. They are also very helpful, and many of you have had contact with your local public health. I always recommend that it's a good idea if you don't have a lot of contact to set up a call, introduce yourself, so that you have, a contact person and a go-to person to be able to talk with. And then, of course, there's also like the quality improvement organizations who've been excellent in providing educational resources to healthcare providers. There's so many different links out there and resources out there for healthcare professionals, the nursing periodicals or healthcare periodicals. And again, the trade associations, always so important when we're really looking at where we can access some of those state of the art leading edge types of resources available. So as you can see, infection prevention in the home setting is really an area that is so critically important in the quality of care for those individuals that you care for, as well as your own caregivers, your families and significant others. And at this time, we will open it up for questions. And please feel free to type your questions in the question and answer box. And I do know we've already received one question, and that has to do with, is it best practice to use, and what I would imagine the RTU is ready to use category N in the home. So please tell me and type in there if I'm not understanding that right, but ready to use disinfectants that are on the EPA list N is what I'm reading into the question. So if I'm wrong with that, please make sure that you answer that. So when it comes to the EPA, they have a list of, okay, thank you. Thank you very much. They have a list of certainly approved disinfectants that are used with healthcare. And when it came to COVID-19, EPA List N is the products that are used when it comes to COVID. So if you look, you can even, are you able to, someone said, will you share your slides? Oh, yes, the slides will be available. So the when it, I thought you meant for this. Sorry, I interrupted that. So anyway, so the EPA puts out their list of approved disinfectants, and then in that list, you will be able to identify. They also have on the EPA website. They have questions and answers, and you're going to have to take a look at each individual product that you're using to make sure that it's safe for your situation. And you're going to have to look at ventilation, and you're going to have to look at PPE, and you're going to have to look at contact time. So you will need to take a look at not the manufacturer, the product information that is located. There's safety information, and you're going to need to follow that because it will tell you, is it safe to use? Do you need ventilation? And for ready to use, you don't have to certainly reconstitute or dilute that because it's ready to use, but there may be a contact time on that. So again, you're going to need to make sure if it's something that could be dangerous for the type of clientele you're working with, you're worried that they're going to take it and use it inappropriately, then you want to make sure that you're also securing it. So check the surface that you're using, check the product directions and the safety, and then make sure that you're also, when you leave, that it's secured. So we have another question. Oh, when training staff, is it good practice to show them using the black light technique which show unclean areas? There are a multitude of different products um, and methods such as black light. There's also, like, for example, the glitter for hand hygiene and all those types of things. Sometimes those are helpful when you're training staff for the simple reason that when they can actually see that they're not performing a procedure adequately, that they could be missing, certain areas. So I would say it's not 100% required, but it sure is helpful when you have other methods of training to show caregivers and staff and employees that if they're not utilizing the products or the technique or the procedure appropriately, they could be, it could not be effective possibly. So yes, that's a great question. So we have a couple other questions that came in on the side. So Tiffany, one came in. Do you find that having higher compliance rates when you offer a virtual training option?
Actually, yes, that is exactly what we found. If we can make the training more accessible, easier for them to access, especially with it being a virtual option, they can access it really any time of day or night. It's definitely going to improve uh, the amount of compliance that we get. So we do see that.
Thank you so much, Tiffany. So we have another question that came in. And let me pull it up here. And it says, how do our employees handle people in the home that do not follow the basic infection standards? For example, with fever, cough, no mask, not covering their mouth. And I would imagine that many of you have encountered that situation. And this is a great question. So if we step back and look at what to do, we want to keep everyone as safe as possible, right? Therefore, if there is a family member or a patient, we would look to see that, make sure, like, for example, if they're coughing, that, we have others in the home wear a mask, right? And then we would educate the person on respiratory hygiene and cough etiquette using demonstration. So again, we really want to make sure that we also give other recommendations such as testing, because we want to know, do they have COVID? Do they have, some other acute respiratory infection? We want to also then talk about cleaning and disinfection. And caregivers would want to make sure then that they're donning PPE consistent with the pathogen that could be present, right? So CDC recommends that if COVID-19 is not suspected, then of course you follow standard precautions, right? Or transmission-based precautions based on a suspected diagnosis. But if you think it is COVID-19, then of course N95 respirator, eye protection, gown and gloves. And then in addition, we would want to discuss with the family member on precautions to take as well as testing. Therefore, it's important for caregivers to carry adequate supplies with them. So we have another question. How would you help encourage family members to adhere to these practices if they don't believe that masks, PPE, vaccines make any difference in providing any protection? So one of the things that I would do in that case, and of course, right now that happens, right? Because if you even read the news, if you have people that believe in every guidance that's out there and best practice and recommendations, and then you have those that do not. And so you may very, very well encounter people who don't believe that they should have to adhere to those practices. So at the end of the day, we want to be able to show them and talk with them about the reasons why, right? We want to give rationale. Then we would again recommend that they do follow those recommended procedures when caring or in the home or being around someone, especially when you're caring for someone who may be at risk. The next thing is we want to make sure our caregivers are taken care of. So they still would follow the appropriate measures, whether it's PPE, those types of things, if we anticipate that there is a communicable disease or infection. So if they do think it's COVID, for example, as mentioned earlier, we would make sure that then the caregivers are donning the appropriate PPE in accordance with the pathogen. But we would want to continue to explain and show rationale, because there are many resources that your team can print out and bring along to share with the studies and the research that go along with it. And many of these resources are easy to understand. So we have another question as well, and this kind of keys in so Tiffany can weigh in. What about family education, right? So Tiffany, were there any areas that you could add on handling education with the family?
Absolutely.
Okay.
Absolutely. So, something that we try to do when we go into a home, we also are trying to leave educational pieces for infection control, infection prevention. Of course, we have other items created for chronic conditions, but especially we want to give out the information for infection prevention. Sometimes people forget, if they're at school, they're at work, they're washing hands, they're doing everything they should do, and then they come home and they think, oh, I'm at home, I don't need to do these items. But sometimes they need that added education and reminders of, especially if we are coming in and providing services, we absolutely want to continue these measures and really keep everyone safe. So the key is doing our best to leave educational pieces. In addition to that, we try to have news briefs that go out to our clients and their families, and we'll always include tips for preventing infections and infection control in there as well.
Oh, I love the news briefs idea. Thank you, Tiffany. That's excellent. We have another question here on how often do caregivers need to be trained in infection control? And I think I'll start this and then Tiffany, you can weigh in as well. I would recommend that annually at least, and then as needed. So as needed means when new information or guidance is published, or if you've identified a breach in practice or an opportunity for improvement, or if there is a leader of your organization that feels because of the urgency and importance of a topic, education should be reinforced. So Tiffany, could you weigh in on this as well?
Absolutely. So annually, I agree with that as well. And then, of course, if there's an issue that arises, a reason as to maybe we think this person needs some added training, bringing them in, doing some demonstration, doing some teach back with them, making sure that we're getting that information to them just so that they can be as safe as possible on their shifts.
So there is one more question.
Okay. Okay, there's a question on, is there a site or platform where we could register that gives us alert regarding the health updates per state regulation? And then for staff caregiver training and quality assurance, what would be the best site or platform where we could register that would give us up-to-date guidance? So when it comes to state, every state is a little bit different. You may want to specifically go to your state Department of Health to see if there is an area where they will let you know of any memos or any guidance memos or updates that come out, because they're all a little bit different. So I would start with going to your state Department of Health website. And they also have areas where if you cannot find it, almost every single state Department of Health that I've seen, because we have people here from many states, but the states that I have seen have actually had areas where you could call and ask those questions. So if you cannot find them, I would give them a call. They want you to have the resources and access, and they really are really good about making sure that you can see where to find and locate those resources. Do you have any thing to weigh in on that, Tiffany?
No, I agree with what you said.
And then for staff caregiver training and quality assurance, what would be the best site or platform where you could register that would give you up-to-date guidance? Tiffany, do you have any suggestions on that one?
I don't. I work really close hand in hand with our compliance department, and they just work really hard to keep track of the requirements in each state and what we need to do. And then we work hard to put those together. Do you have something you'd like to add?
The only thing that I would like to add with that, besides your own state, because the state will provide you also, that's why I do recommend that you do go ahead and find out where you can locate their up-to-date information. But the Centers for Disease Control and Prevention, many states will refer you back, especially during the COVID. If you look at the states, many of the states just referred back to the CDC websites. There is a CDC web link, and if you Google search it, it's CDC What's New. And then you can scroll, there's an area where you can click for healthcare professionals. Otherwise, you're going to get the schools, the cruise ships, the dental offices. And then you will be able to see, you can check it, if you want to check it a few times a week to see if there's anything new. It was really when COVID came out. So I don't know if they're going to continue with all areas, but the CDC really does have great resources to keep you up to date as well.
Listeners, visit comfortconnections.com to download complimentary resources, view show notes, and access our episodes. You can also subscribe to our podcast on your favorite app. Thank you for listening and helping older adults live their best life possible.